Well, thank you very much. I'm Dr. Kevin Kavanagh from HealthWatch USA. I would like to talk to you about how best to avoid getting COVID-19 when seeking medical care. During this real short presentation, we're going to emphasize that we're still in a pandemic. We'll look at the impact of COVID on healthcare workers, the role of vaccinations, ventilation, and masking, along with the type of doctor visit and how that impacts how you would handle prevention, preparations that you need to take before a doctor's visit, and finally, the Americans with Disability Act. Now, I can't underscore this enough. We are still in a pandemic. This is a graph from Our World in Data, which is a program of Oxford University in the United Kingdom. And as you can see, we had a significant peak in hospitalizations. The United States is in blue. Not as much as last year, but still a significant peak. And in general, these hospitalizations are primarily those with severe pulmonary disease. They tend not to capture people who come in with sequelae of long COVID because that's such an unrecognized sequela of COVID-19. It's unfortunate, but it's still true. If you notice, there tends to be a lull in May and June, and this has been true over the previous years. However, I need to emphasize that SARS-CoV-2 is not a seasonal disease. Even that lull still has unacceptable number of hospitalizations. You're still well above 5,000, and that really is not acceptable. Infections are even higher. If you look at wastewater data, there is indications that we may be in the second highest wave of infections that we have ever had during this pandemic. Now, this is data from Epic Medical Records. This is what Epic Research does, is they comprise the data from at least 50% of their healthcare facilities, which currently are using their medical record system. And as you can see, we are currently in a spike of both COVID-19, RSV, and influenza, both in new infections, ER visits, and hospitalizations. Luckily, we are decreasing in the rates of these infections. However, for hospitalizations, there are more COVID hospitalizations than influenza. And this underscores that COVID-19 is in fact more severe than the common seasonal flu, and it is certainly more infectious. But they both can cause serious illness, so you should be vaccinated to both COVID, the flu, and of course RSV. If you look at throughout the year, COVID-19 is really not as seasonal as flu. Flu has a very nice peak during flu season, as COVID-19 tends to have a summer peak and a winter peak, and really never does go back to baseline. But there does tend to be that little lull in April and May, which if you can time a completely elective procedure or medical visit, that's a good time to do it. Now, a recent study from Help Advisor, they looked at last year's U.S. Census Bureau data, and they found that 1 in 4 American adults who have had COVID-19 suffer from long COVID. Unfortunately, almost everybody has had COVID-19 at this point. And data shows that almost 50% of those with long COVID will have persistent symptoms. They may improve somewhat, but they do not go back to baseline. Now, cases and deaths are way too high, and right now we are still in a danger period. And one of the main points to this talk is that dosage matters, and this includes exposure time and also concentration of the virus that you're exposed to. Those are two very important variables. And under concentration of the virus, that will include the number of people you're exposed to, but also the current rates in the community. And that's why knowing what the community infection rates are so important. And unfortunately, as you know, that data is no longer available. And we'll also briefly talk about mitigation techniques with vaccinations, masking, and ventilation. Now, there have been two articles which have demonstrated dosage effects of COVID-19. The one is by Lind et al., and this was published in Nature Communications. And this looked at a prison population and compared those who have had prior infections, vaccination, and hybrid immunity. And they broke down into three categories. One is no documented exposure. The other is exposure to someone who had it within their cell block. And the third is exposure to someone within their cell, which is very close contact. And these are hazard ratios. And basically, 1 is you get it for sure, 0 is you don't. The higher is the worst. So as you can see, with no documented exposure, there was still transmission, but it was much lower than with cell block exposures and with cell exposures. You can also see that prior infection gives a little bit better immunity than the vaccine, but hybrid immunity by far is best. So the takeaway home here is even if you've had an infection, you should get vaccinated. And in fact, all immunity wanes all too quickly. And because of that, vaccines are one of your key ways of preventing getting COVID-19 or long COVID. And one of the things you can do is try to time your vaccination or your booster to a major procedure. When I had major cancer surgery, I had a booster to Delta 2 to 3 weeks before the surgery, so my antibodies would be at a peak when I went in for a hospitalization. Now, another article by Ferretti et al., and this was in Nature, and this looked at cell phone tracking data. And again, this is just relative comparisons. You can't look at their actual hours of exposure because you really don't know the degree to what that exposure was. But what they did find is that longer exposures at greater distances had similar risks to shorter exposures at close distances, and that there was a linear relationship between the time of exposure and the probability of transmission. So the longer you're in a place, the greater your chances are of getting SARS-CoV-2. Now, healthcare workers have also been severely impacted. If we look at long-term sequelae, they are not good. A report out of Germany evaluated 104 healthcare workers, and 47% of those reported having long COVID symptoms lasting more than 90 days. And what we've stressed before is that of that group, you'd expect half to at least have some lingering symptoms. So long COVID is not rare. You can't recognize it because someone doesn't display it necessarily as they're walking down the street. But people are having heart problems, they're having brain fog, they are having significant sequelae, and it is a lot of people. These are large numbers. This is another study from Brain Imaging and Behavior. These researchers evaluated 45 healthcare workers who had mild COVID-19 and compared them to 42 healthcare workers which did not have COVID and were healthy. And they found that there was significant abnormalities on both neurophysiological and attention testing and also MRI changes, which revealed impairment in orientating, executive control. There was cognitive impairment, which encompassed general attention, memory, and executive dysfunction. Executive function is your ability to handle stress, to not fly off the handle, to reason, to compromise, etc. And so this, again, was a very disturbing study. The healthcare workers have been severely impacted with this disease. Now, brain fog is one of the most common symptoms which is present. Brain fog has been reported in almost 50% of patients with long COVID, who are also dealing with other cognitive concerns such as memory loss and difficulty concentrating. So again, brain injury is a severe problem with COVID-19. And there's a number of research articles which have pointed out that the brain ages quickly And brain defects which found in COVID-19 patients in this study were equivalent to the brain aging 20 years. Now let's talk about vaccinations. Vaccinations and boosting is one of the key ways to protect yourself. Recent data posted by the CDC has shown that the new booster's effectiveness in preventing symptomatic infections with JN.1, that's our current circulating variant, was 54%, and that was at a median of 52 days after vaccination. That's, less than 2 months. That's not great. A good vaccine would be less than 2 years. But nevertheless, it is a tool, it will help protect you, and it's something you should definitely consider before having major procedures. Unfortunately, only 21.8% of the adults have had the new booster at the end of January, and only 11.6% of children had the new booster by the end of January. Let's talk about ventilation. SARS-CoV-2 can be spread by shouting, singing, and talking. It is airborne. There is no safe distance indoors. So when you're indoors, you have to take mitigation strategies. Even 60 feet is unsafe. So when you're indoors, you have to implement mitigation strategies. Outdoors, aerosols dissipate rapidly, but large particles can still travel short distances. So if you're in a crowded area, close to people, again, you want to be following mitigation strategies. A very important tool is portable CO2 monitoring. This is an example of a CO2 monitor, one which I own, the Arnet 4. And this is an example of the graph over time, which I can get on my cell phone. This will tell you when you're in an unsafe situation. Now, granted, if you use this when you go into your doctor's appointment, you've already gone into the building, but it will alert you that maybe you need to hurry up that visit. And maybe if it's very high, you need to consider obtaining another provider for a follow-up appointment. Now, I should also add that you want to be in a building where the pCO2 levels are below 700. Masking. Unfortunately, masking has now become more of a symbol of personal freedom. This is a cartoon which I think kind of exemplifies how ridiculous that argument is. Masking is something that we need for public health, not just personal health. But unfortunately, that doesn't seem to be taking place. Now, masking effectiveness is something that I cannot stress strongly enough. This table was produced by the Rockefeller Foundation, and I have found it to be extremely helpful. Now, I need to stress that this data is relative because the amount of time you have is contingent upon the variant of virus you're exposed to, its infectivity, and the concentration of the virus that's in the room. So these time periods will vary tremendously depending upon viral concentration. So don't say, hey, 20 minutes, I'm safe. Well, you need to look at this table and say, N95 masks are much better than cloth masks. Two-way masking is much better than one-way masking. N95 masks are much more effective than cloth masks, as shown in this table. As you can see, cloth masks in this table has 20 minutes of exposure. If the source is not wearing anything, they'll provide you 20 minutes of protection. As a fitted N95 mask, 2.5 hours. Non-fitted, they have listed at about half the duration or half the protection. If the source is wearing a mask, that would be, universal masking, two-way masking, you have 5 to 10 times the protection. Now, one of the problems with one-way masking is that this virus can still enter through your eyes. So again, the chances of transmission without a mask in this experiment was 17%. The chances of transmission without eye protection was 16%. So masking is a little bit better at preventing transmission, but I have to tell you that it is not solely protective because you can still get this virus through your eyes, so you need to take additional steps besides masking. Now let's talk about the doctor visit. The type of doctor visit is very important. If it's a routine follow-up, you can plan. You can time it with low rates in your community. And you can call around to different providers, see if they'll wear an N95 mask for you, see if they'll give you a morning appointment. And that is extremely important because you'll less people around if you can be the first appointment of the day. If not that, try the first appointment after lunch. Now, if it's a non-urgent new problem, you may only have weeks to plan. If it's urgent care, you can't plan. You have to be seen that day. You have hours at best. So it is best really to take steps before you need to go into the emergency room. Figure out what emergency rooms have the shortest amount of wait time. Figure out which emergency rooms will let you wait in your car and then call you by cell phone, so you're not hanging around in the emergency rooms for long periods of time. Now, preparation is extremely important. Remember, your risk of contracting the virus is equal to the exposure time. You want to be up to date on your vaccinations and boosters. You want to be wearing an N95 mask, but also call ahead and ask questions. Will the staff wear an N95 mask? Are masks required for all patients? That latter question, the answer is probably going to be no. They're optional. Well, that means they're not required. They've always been optional. And of course, you want to spend the least amount of time in the waiting room. So you want to have first appointment in the morning. At second best would be first appointment in the afternoon. Ask if you can wait in your car and be called in with a cell phone. If you can't get a first appointment, do all your paperwork online before the appointment. Wear an N95 mask. If you have to sit in a waiting room, sit in the corner of the waiting room where an air vent is on so the air is flowing away from you and not towards you. And I always find it helpful to bring some alcohol wipes that I can put on high contact areas or wipe down the chair handles, etc. Some people also bring a little portable UV filter. I'm not sure if that works or not, but I do own one and have had one to use in the past. Now let's talk about the Americans with Disability Act. There have been two recent studies, one the INFORM, the other the EPOC study, which showed that immunocompromised populations are at severe risk for COVID-19, and they emphasized that they are not optimally protected by COVID-19 vaccinations, and that they require additional preventive interventions to mitigate the risks of severe COVID-19. You cannot avoid going to healthcare settings, and it is ethically, morally, and I feel even legally on that provider to provide you a safe environment to get the medical care which you have to have. If you look at the ADA Act, there's several sections of this act. One is Section 36.211, which requires maintenance of accessible features, and this should be having adequate and safe ventilation. There needs to be firm regulations regarding HVAC systems and air exchanges per hour. The other section of the ADA, Section 39.301 of the ADA states a public accommodation may impose legitimate safety requirements that are necessary for safe operation. And thus, mandatory masking and safe ventilation appear to be within the purview of the ADA, and they should be provided by healthcare providers. And in addition, 36.208 states that when an individual poses a direct threat to the safety and health of others, the facility does not have to provide services to that individual. In other words, they can require people who are direct threats to immunocompromised individuals to be wearing N95 respirators. This is within the purview of the ADA. From what I can see now, there is not the willingness of providers to, on a large-scale basis, provide safe environments, and unfortunately, it's falling on the onus of the patient. Many patients I've talked to are missing needed health care because the ADA is not being followed by healthcare providers. So thank you very much, and I'll now take some questions.